Good afternoon, everyone. Today is Wednesday, May 9th, and I would like to talk about how stress affects the skin. And it really doesn't matter what underlying skin condition we are naturally predisposed to. It doesn't matter whether an individual suffers from acne or rosacea or psoriasis or hives or hair loss or nail biting or vitiligo. Regardless of which skin condition you think about, many of them are directly associated to stress. So essentially, we can say that for most of them, the more stress you feel, the more flaring you're going to see, and the more difficult it's going to be to control those conditions. Now, there are two different kinds of stress in my mind. One would be emotional stressors, like the loss of a loved one, or emotional stress from finances, or from worrying for your children or for your parents. Those are emotional stressors. And then there's physical stressors, like you were recently in a bad accident, or you have you run around dehydrated. You don't hydrate yourself enough, or maybe you're not eating a balanced diet, or maybe you're not sleeping well enough. All of those things are contributing to stress that you may not feel. You may not be able to recognize, but the body recognizes it. And the body naturally increases the level of cortisol, and it increases inflammatory mediators in the bloodstream. And that is, it's a perfect scenario for flaring of conditions that you may be automatically predisposed to. Now, because we are talking about inflammatory mediators, and because the skin is an immune organ, those inflammatory mediators are going to automatically affect the skin. And they affect people differently. If one individual is genetically predisposed to having rosacea, and the other one is genetically predisposed to having psoriasis, the inflammatory mediators that they may experience, that surge of mediators that they may experience in response to sleep deprivation or in response to emotional stress, anxiety, may cause one person to flare in their rosacea and the next person to flare in their psoriasis. But the point is that their underlying skin condition, the one that they have, that they suffer with, is going to be worse. And then it's not uncommon for those individuals to show up at the office and say, well, my psoriasis is worse, or my acne is worse, or I'm breaking out in hives every day, or I'm losing my hair. And then to turn around and say, okay, well, here's this cream, here's this pill, here's this treatment plan, do this and you'll get better. And really, at the root of the problem is the fact that the individual is now stressed, and 2-3 months ago they were not. Whether that stress be emotional or that stress is physical, but their body is perceiving a stress. It's so difficult for me as a physician to look at someone who is essentially in a flare and to say, oh, this is happening because you're stressed. It's difficult for me to say that. What I see is I see an inflammatory reaction, and I say, okay, this is how we're going to treat it. But if that individual does not respond to treatment, or requires a little bit more treatment or stronger treatment than what I would have expected, then I begin to question, well, is this typical for them? Is this how they live? Are they in their normal state in their environment, or has something happened? Is something new for them? And it's hard to be able to pinpoint exactly what that is. Many times when I straight out ask someone, they will say, it's because this happened. It's because my mom died 2 months ago. It's because my husband had a stroke 6 months ago. It's because I'm having financial issues. There's always something that people identify. It's not uncommon. And so basically, at the root of the problem is a perceived stressor from the body. Understanding that and knowing that is important, because many times, I'm not going to say all of the times that there's a flare, it's because there's stress. No, by no means is that the case. But what I'm going to say is that many times when we're trying to treat something from all these different angles and we're getting nowhere, it's because that individual is stressed and the stress is ongoing and significant, and we haven't identified it and we haven't treated it. And so what's important is to go back as a patient. If you happen to be somebody who's suffering from a skin condition that's difficult to control, it's important to go back and say, and look in your life and say, well, could I be emotionally stressed? And quite possibly address that stress in the form of stress reduction techniques. And being a dermatologist, I have very little training in terms of stress reduction techniques, but at the top of that list, I typically tell my patients, there's exercise, there's meditation, prayer, and even massage therapy. All of those things have been shown to reduce stress. But there's a number of others, like breathing exercises and whatnot. I tell patients, go look into what you can do to reduce stress in a healthy manner. And if you can't do it alone, seek help, whether it be help from your primary care provider or from a psychologist or a psychiatrist, whatever it is that you need to control that stress, because ultimately, if you control your stress, you will have a healthier outcome, overall good health. And that will downstream will actually equal to organic health. Like there will be a decrease in inflammatory mediators and better control of your skin conditions. And physical stressors are exactly that way too. So if you're not drinking enough water, and believe it or not, a lot of people do run, especially in Texas, where it's always hot in the summer. They don't hydrate themselves well. Many of us are on diuretics, and it's very easy to be dehydrated and to just go about your business like nothing's going on. Well, your body's going to perceive that stress. And it's not uncommon for me to see somebody who's just dehydrated, not drinking enough water, and they're coming in to see me for hair loss. So those are the sorts of things that you need to think about. Or similar scenario, they run just a little bit dehydrated and they're coming in to see me because they have itching, and they have itching because they have dry skin, and they have dry skin because they're running around dehydrated. And anyways, it all is connected, is the point. You have to go to the root of the problem. If you think you have a skin condition that's not appropriately managed, well, then maybe it's important to go to a dermatologist, get that addressed in the form of creams, medications, treatment regimens, whatever is needed to get that under control. But if you find that you're still having trouble, the next step would be, or somewhere along the ways, you should think, well, maybe stress is contributing to some degree, because chances are it very well could be. Just food for thought, things to think about. I encounter skin conditions that are flaring from stress every single day. So, from the Alamo City, this is Dr. Ana Sauceda helping you put your best face forward. Take care.